Hi, my name's Philip Robinson. I am from Australia and I'm coming to you from the beautiful city of Amsterdam here at EULAR 2018. I want to tell you about some great gout abstracts today. The first one is from the NHANES study data set, and that shows that the prevalence of gout is directly correlated to the serum lead levels. Now, that lead poisoning causes gout is not a new finding, but it's a reminder that to think about this in early onset patients or those with occupational exposure. There's some more NHANES data also that shows that rheumatologists aren't doing too bad a job, and in fact we're getting better at treating gout patients. The proportion with at target is increasing over time. Still, the absolute level's pretty low, it's less than 20%, so we've still got a way to go. And the next interesting poster was one done by Hyon Choi from Boston, and he looked at the changes in blood pressure in the pegloticase trials, and he showed that on average you got a reduction in around 8 to 10 millimeters of mercury with pegloticase treatment. So certainly this is a pretty controversial area, and there's been lots of studies about association with blood pressure and uric acid, and this is a small study, but certainly something that needs to be followed up. There's another really interesting study looking at anakinra treatment in CPPD, and it was a small study, but it showed a substantial reduction in tender and swollen joints with people with acute CPPD arthritis. And finally, I think it was a really lovely study from Ed Roddy in the United Kingdom. They took 150 gout patients that came to their clinic and split them between follow-up in general medicine with a general medicine specialist, follow-up with rheumatologists, and discharge with a plan to general practitioners. And they found that those that were discharged to general practice had a lower level of attaining their serum uric acid target. So I think the take-home message is that these people probably need to be looked after until they're at target instead of being discharged with a plan. And there's lots more coverage at rheumnow.com, so I encourage you to go to the site.